All right, good morning, ladies and gentlemen. Please find your seats. Welcome to the 12th Annual UC Davis Pre-Nursing and Pre-Health Professions National Conference. My name is Ishan Mosin. I'm your Director for Pre-Nursing and Pre-Physician Assistant Programming. So first off, I want to thank you all for coming today, all the attendees, the speakers, and the professionals. Many of you have traveled a long way to contribute to this grand event, and I'm confident that it'll be worthwhile. I would also like to thank AAMC for sponsoring this event, and the countless volunteers and my team of coordinators, without whom organizing this conference would not have been possible. So at this time, it'd be my greatest pleasure to introduce our first keynote speaker. Having served as the Robert Wood Johnson Foundation Health Policy Fellow in 2007-2008 while working for the former Speaker of the House, Nancy Pelosi, having served as the Vice President of Patient Care Services at a hospital of the Johns Hopkins Health System, the Director of Nursing for Emergency Medicine at a Johns Hopkins Hospital and its School of Nursing, and now an advisory board member and chair for Academy Health's Interdisciplinary Research Interest Group on Nursing Issues, and the newly appointed CEO of the American Association of Colleges of Nursing, she epitomizes leadership. Given her long list of accomplishments, her advocacy for strengthening nursing education programs, her significant involvement in health policy, and her vision for progress in making health advancements is not just a promise, but a guarantee. It is my honor to welcome Dr. Deborah Trautman.
This is actually not working right now.
That's one of the best introductions I've had. Thank you very, very much for very kind words. Okay, am I on your way?
No, it's not right.
Okay.
Experiencing some technical
Oh, that's all right. I'm an emergency department nurse. We can deal with technical difficulties. So I want to say welcome to all of you, and it's wonderful that you're here today. I'm thrilled to join you. I flew in last night, and unfortunately I have to fly right back out today, but it was so important to be here. If you're considering nursing, it is an extraordinary profession, and I will tell you that it has taken me in a direction. People have said to me, so did you ever think that you would become this, and I'll talk about AACN in a minute, don't worry if you can't get it, the CEO of the American Associations of Colleges of Nursing. Never, wasn't on my radar screen, but the profession gives us unlimited opportunities to pursue and expand who we are and what we can do. So I've had the benefit of being a nurse who has practiced. I have had the benefit of being a nurse who has taught, and I've had the benefit of being a nurse who has learned about advocacy and the importance of the nursing profession contributing to advancing better public policy in this country for all Americans. And I'm just thrilled every day. I learn new things, and so if anyone's in any doubt about, is this a profession that I would think about pursuing that could be rewarding for me, I would say there should be no doubt. It most certainly can be. And it takes all of us in different directions, so there isn't one particular path. That's the same as our education. There's not one particular path for our education. It's still creating a little bit of anxiety in the profession, but I think that what we bring, and many agree, is, and you may know this, that when they survey, Gallup poll surveys, across professions, who are among the most trusted professions, nursing consistently is in the top of the trusted professions. Now, something we need to work on, it's not my PowerPoints, but if we don't have them, that's fine. No worries, you're better, I think you'll like this talk better than the PowerPoints, but in nursing, we are trusted healthcare professionals, but we are not recognized as being leaders. And our country, many of you get to hear Dr. Harvey Feinberg's remarks in the main room. I think he was right on target. We are in an unprecedented era of opportunity for this country. We have a lot of debate about what we should do to fix things. But the good news is, in this country, we recognize that we should be doing better. We should have a healthier population, and we should have a better functioning healthcare delivery system. We don't have that. The United States, many of you may know this or may not, we spend more than most other industrialized countries on healthcare, and yet we have the worst outcomes. For the first time ever, the United States is leading all other countries in obesity and the sequelae of the chronic diseases that result from that. So there's so much opportunity. There's a law that was passed not so long ago. Some people love it, some people hate it, and I appreciate that, and I'm not going to convince somebody to love or hate it. But as you heard, I had the distinct honor and privilege to work for the Speaker of the House, and I was able to be there for 3 years, which is the unprecedented opportunity. The Robert Wood Johnson Health Policy Fellowship, I'm going to plant this seed now too, but I'll come back to your immediate next steps in your profession. It is an opportunity, it's an honor to be accepted. The RWJ started the Health Policy Fellowship in the 1970s. The intent of the fellowship was to bring healthcare professionals to Washington, D.C., give them an opportunity to have a better understanding about what happens in the policy world at the federal level, and then the intent was to impart some medical, nursing, health professions knowledge to these policymakers. It initially was targeted for physicians. They now, like others, and you heard Dr. Feinberg say this, interprofessional, interdisciplinary, whatever term one wants to use, that is the direction for the future. So there will be, for all of us, opportunities to expand our concept of what it means to be a team. But anyway, to come back to the fellowship, so I was a health policy fellow, and I had the opportunity to see, although there's a lot in Congress that is not pretty, I did get to see that there is something you don't realize. There is a tremendous amount of intellectual capital, most certainly from the staff that work on the Hill. There's a lot of attorneys, there's a lot of PhDs, and Republican, Democrat, Independent, what you see that's most common is there's a passion for taking us from wherever we are today and making it better. There's a lot of disagreement about, again, which way to go to make it better. But that is, I think, what has been incredibly exciting. Since the PowerPoints aren't available, so my PowerPoints were to tell you a little bit about AACN, to tell you a little bit about the current state of the healthcare environment and where I think it's going to go, and then to tell you some specifics about nursing. So I'm going to try to do a little bit of that, and then I'm just going to share some of my career. And the number one point I would say is that if you enter this profession, you're guaranteed that there's a lot of opportunity. It takes time and there are challenges. Every door doesn't, as you know, in any profession, always open at the moment that you want it to. My first management job that I applied for, can you believe they turned me down? To this day, I say they made a mistake, but I remember coming home and telling my father, I applied for the manager job and they didn't accept me. He was like, well, they had a more qualified candidate. I said, well, I'm not sure that I agree with that. But anyway, the point was that that I learn a lot from that, and so not every door, it's not a path of roses. Everything doesn't always work out perfectly. But what we get to do, and we get to do it, and we always, when I was trained, we said bedside. I would now like to say at the patient side, because when we're delivering care, it can be out in the community. That care right now predominantly is still in hospitals. That's mostly what's happening, but that's going to change. More and more is moving out into the community. There is a much larger focus on prevention. So I think that we're going to see, again, great opportunities. For nurses entering practice, I'm still getting the term, so I've been the CEO at AACN for 4 months. So give me a little credit, but I don't have all the language, even though I've been in nursing for forever. There's still some acronyms and language that I haven't fully grasped. But so the current terminology is so pre-licensures, everybody who's studying before you take the exam and then you officially become a nurse. And then there's many, many paths afterwards. Some people go right on to pursue advanced education immediately. People have asked me, what's the best course? There really isn't, I don't think. I would be concerned if someone said to me, oh, you must do this. I think that there's a couple different factors that have gone into my decision making. So in the absence of the PowerPoints and not remembering all the detail, I'll try to share a little bit of my story, not to talk about me, but just to have it be maybe illustrative of how some of these decisions that I made. So I graduated from a baccalaureate program, and it was a small school that I went to, and I immediately wanted to start practicing. I wanted to be an emergency department nurse, but at the time that I graduated, emergency department nurses, even though there was a shortage in the country, you had to have experience. So I worked on a surgical floor for a few years. I'm hate to say this because I'm now old enough that some of these people they don't go to the hospital anymore for the surgery that we took care of. But I'm not quite the dinosaur yet. But things change, and that's the good part. That's my point, that what you know in nursing today, it won't be the same 5 years from now, and it shouldn't be. So after I worked as a nurse it was 1 year was the minimum that we needed to have experience before going to an emergency department. I applied and went and then worked in an emergency department. I learned so much about teamwork there, and there is teamwork across all specialty areas, but some have more than others. And I would suggest to you, and this is for later on, but once you're a practicing nurse, another thing that I did that was very helpful, I almost took a job in an area because it was the first position that was offered to me. And a colleague of mine said, that might not be exactly the area that you're looking at. So talk to people who are already working. Same with your path for education. I would suggest that talk to people. Most schools will connect you with students. Talk to people who are interested in doing what you're doing or what you think you're interested in. At the end of the day, I worked for a while, and I never, ever, so never say never, I never thought I wanted to have anything to do with management or leadership. In fact, I was quite certain I did not. And then when I was taking my master's education, when I was pursuing my master's education, I took a course that was taught by a woman by the name of Marguerite Schaefer. She had been a dean. My roots originally are the University of Pittsburgh. She had been a dean at the School of Nursing there. I didn't know her when she was a dean. That was much earlier on, before my time. But she was teaching this administrative leadership course. And I just got so inspired. I drank the Kool-Aid, and I'm like, okay, well, maybe I could do this. So I had the best management job ever. Was that while I was working on my master's, I applied for and was accepted as was a weekend supervisor, different titles now, but essentially the nursing supervision for the hospital on the weekend. It was the best job. You dealt with problems on Saturday and Sunday, and then you turned them over to someone else to fix on Monday. But it was great because I got to go around the hospital, get to know more about nursing and nursing in other areas. When I finished my master's and I was working in the University of Pittsburgh Medical Center, I want to tell you a story. So as a staff nurse, though, let me come back to this in the emergency department. We hosted events like this to encourage people to come and work at our hospital. And it used to be that the managers always did the hosting. But as a staff nurse, we had to have a project. And I said, well, I'd be happy to host and talk to people about nursing and emergency nursing. So I did that because it was something I wanted to do, because my job required that I have some kind of a project. They had these nice receptions. I was a poor student, so I also got lunch as a part of it. But I also got exposure. I didn't realize that. Exposure with senior leadership in our institution, who then recognized, not just me, Deb Trautman, but a nurse, and what a nurse was bringing to really sell the institution and genuinely do so. So anyway, then down the road a little bit, after I completed my master's, I taught in staff development. So clinical teaching went to other nurses. And as a part of the work that I did with other nurses, before its time, I would say, we developed what was called a clinical competency verification program. And we came out here, well, actually, we came out to California to do the presentation, and then we were invited to do a presentation in Salt Lake City. And when we were in Salt Lake City, someone came up to me and said, Johns Hopkins is looking for a nursing leader for emergency nursing. Would you be interested? I said, oh, no, never. I loved what I was doing in Pittsburgh. So anyway, I could go on and on, but the point of it was I've learned that when I say no, it ends up maybe not being the case. So what I've learned is to be open to these possibilities, even if it's something, and that's the same that happened with this most recent position. I knew about the woman that was retiring. She had done great work. The American Association of Colleges of Nursing is an organization that its membership is the schools of nursing across the country. It's not all schools. We have over 800, and 755 are members of the American Association of Colleges of Nursing. It first started to help support the deans. It is now much larger than that, and it's intended to support deans, faculty, and we have some great programs for graduate nursing students. We have a wonderful policy summit, so how it all comes full circle. Remember that nurse that I told you that was a dean that taught the management course that I got interested in management? She was one of the founding members of this association. I mean, I didn't know that at the time, but it is really amazing how connections and relationships that we have. I think that for each of us, there isn't, again, one prescribed way, but we are seeing increasingly more opportunity that nurses are respected by the general public. Nurses every day have an opportunity in inpatient care, in the community, working in policy, working in research to help generate the evidence that we need and participate in the decision making about what's going to be important to move our country forward. So maybe with that, since we probably have a little bit of time, but there's not that many people here, are there any real particular questions that I could answer so that I just don't go on and on telling you about, I will say it's been a fabulous career, and I hope and expect that each of you would have the same. It's not always easy, and there are times where it's been extremely difficult, but it's a good career to be a, yes? No, I started my undergraduate, I started it at West Virginia University, and then I transferred to a small private school in West Virginia Wesleyan College. Yes, well, there was no one in my family that was in healthcare, so everyone's still wondering, why did I want to be in healthcare? Well, the reason, no, they're not wondering, but my very first job was I was a short order cook, and I was terrible at that. So anyway, I didn't even enjoy that, but it was my first job. My second job was I worked as it was called a nurse's aide, and I really was struck by it. It was a great place, and people worked really well together, and I got to see all the different professions. But there was a nurse that I just, to this day, remember. She was smart. She was able to bring people together and get people to work together. She was resourceful because there were a lot of times where things should be in place that weren't. She was a critical thinker. She was a leader. I didn't realize all of those attributes at the time, except to know that who she was and what she did for the individuals that I saw her care for and the team. I said, I would like to be a little bit like that. So that's how I believe I got into that decision. I'm the first person in my family to have a position in healthcare. And so there were times, though, so I'd come home, so emergency nursing, I don't know why, it excited me. And I can tell you, though, I think my passion for emergency nursing also served me well in the speaker's office because in my view, not to be quoted in the press, of course, is that there's a tremendous amount. The Speaker of the House, Republican or Democrat, they coordinate the agenda. And they deal with much more than health, but I'll just speak to health. So the Speaker has to have a tremendous wide breadth of knowledge. And then the depth, depending on what the issues were. She actually had tremendous depth and breadth. But that's kind of how I saw emergency nursing. We had to know a lot, but maybe not as in detail, perhaps as what an ICU nurse would know about a particular metabolic condition, but enough to be able to manage the situation and then know when you needed to get more information. You have to be comfortable with chaos and uncertainty. I love chaos and uncertainty. Not every day. I like a little bit of balance, but I thrive on that, what's unpredictable. If you like a lot of structure, emergency nursing's probably not, some might disagree, but I don't think that would be the best place to go because you just never know what's going to happen. But another question? I see one in the back. Oh, out of time? One more? Sorry. Yes. And you said you are going to, or you want to? Yes. Well, I think that, sure. Oh, yes, it's a good idea. Sorry. Repeating the question. What did I think about specialization in nursing? And one person in particular is interested in diabetic, and in particular diabetic foot care, right? So I think that, in a way, so even though the profession gives us all these opportunities, emergency nursing was my area, what I think we can do is, we don't all know which one we're interested in. So if you know, then I'd say pursue that. But if you don't know, then there's opportunity to, I didn't know when I graduated, so I went and worked on a general surgical floor. I was going to go work in medicine, but the medicine really, the surgery was more what I was interested in. It was a little bit more fast paced. It was more turnaround. It was getting people ready for the OR. They had their surgery, they came back, we helped them get ready, and then they went home. So it's learning more about those areas. I mean, and it's as much about that disease, whatever the disease is about how the work is done. So I do think there's going to be increasingly more work done out in the community. And so if that is an area of interest, you could not only be practicing in that, but you could potentially be on the part of, leading on a frontier. I think for me, it was good to have sort of a little bit more wide breadth and then to be able to narrow down through experiences. I just got the wrap-up sign. I hope it was helpful for you. There are some wonderful PowerPoints that we're glad to share. I have an email address at the American Association of Colleges of Nursing. I'm 4 months in, so I'm still just barely keeping my head above water, but if you send me an email, I will be happy to connect you with someone and or offer any comments. Nursing is an extraordinary profession, and if I've done nothing else today, I hope that I assure you that, and it's not always easy, and sometimes it's incredibly difficult, and sometimes we nurses make it even more difficult for ourselves, but I would say that we're a profession that's highly respected, growing in diversity, and has a tremendous, tremendous amount to offer to improve health and healthcare in this country. Thanks so much. Thank you.